Hi, welcome to This is Getting Old. I'm your host, Melissa B., PhD, and today we're going to be talking about Medicare and the fact that it doesn't have a dental benefit and why that's a problem as we get older. For younger populations, we've done a lot of things to improve our oral health. We've put fluoride in our water. We've developed the ability to put sealants on teeth, and that has helped protect people from getting cavities and actually losing teeth when they're younger. But as we age, we still see a lot of cavities, people losing teeth, a lot of gum disease. And the biggest reason for that is just the lack of ability to pay for dental services. So when I say the term oral health, what I'm talking about is a mouth that's free of broken teeth, sores, infections, things like that. And I was actually really interested to find out that the World Health Organization ranks oral diseases as one of the top non-communicable diseases, which means a disease that you get by an infection. So it is the top problem globally. And so here in the United States, we have people that haven't been to see a dentist in over a year. In fact, an AARP did a study that showed that 1 in 6 older adults haven't been to the dentist in over 5 years because of this issue with paying out of pocket for dental care and lack of insurance. The term oral health has to do with how healthy your mouth is. So do you have broken teeth, sores in your mouth, infections? Because all of these things impact our ability to bite, to chew, to talk, and actually can impact our ability to want to go out and socialize with other people. Today, more than 65% of Medicare beneficiaries do not have coverage for dental care. And ultimately what this means is that dental problems aren't taken care of early. In fact, they tend to fester and grow, and this can lead to infections and even hospitalization, and sometimes can even result in death. So today we're going to be talking with Taneika Duhaney. She's a dental hygienist and a healthcare administrator for the United States Navy. She was also a health and aging policy fellow with me and got interested in improving oral health for older adults. So welcome to This is Getting Old. I'm your host, Melissa B., PhD, and today we're going to be talking about the fact that Medicare doesn't have a dental benefit. So I'm joined by Ms. Taneika Duhaney, and she was also a health and aging policy fellow with me. And so maybe just tell me a little bit about yourself and how you got interested in oral health and dental care.
Oh, hi, Melissa. Thank you for having me today. So my background in dental is quite a boring one, actually. I was deployed to Kuwait in 2003 as a dental assistant and got the opportunity to work on Marines who were pretty much on the front line. And they didn't have time really to pay attention to oral health when you're considering all the other things that they had to contend with. And so shortly after that, I applied to dental hygiene school, and the Navy funded my education. After hygiene school, I went to Yuma, Arizona, and in Yuma, I had the opportunity to work out in town where they have a significant elder population. And therein lies my interest in oral health and the older population.
And my connection with that is that even though most of my work is around hand feeding techniques, those techniques can also be used to help people brush their teeth. So it was a natural fit for us to get connected. So tell me a little bit about your experience as a health and aging policy fellow.
So during my fellowship, I had the opportunity to connect with Community Catalysts. They have a huge focus on oral health. I also had the opportunity to work with the Department of Justice, and they're focused on elder abuse. And during this time, we had the opportunity to look at policies that impacted older adults from several different avenues, the local, federal, and state levels, assessing advocacy, policies that were being introduced, and how we could change legislation during my fellowship here.
So speaking of that, we met last year at the communications conference, and we're talking about writing a policy brief. So tell me a little bit about some current legislation to try to help older adults.
So there is a lot of legislation right now support in dental benefits, and it has increased over the years. There's the Medicare and Medicaid Dental Vision and Hearing Benefits Act of 2019. This bill would add a dental benefit to Part A and Part B of Medicare, ensuring seniors and people with disabilities have access to dental services they need to manage chronic conditions and support their oral health. The House passed H.R. 3 in mid-December 2019, which included a provision that added oral coverage to Medicare. Unfortunately, though there is progress in the House, we don't seem to have traction yet in the Senate, but we will continue to inform policymakers of the significance of adding a dental benefit to Medicare.
So let's talk about that. Why is it important for older adults? I mean, I know that there are a lot of programs in place to help children get to the dentist to maintain their teeth and things like that. So why is it so important as we age?
So Medicare currently covers medically required procedures. So if an older adult will get an organ transplant or cancer treatment, that's deemed medically necessary. And so that procedure cannot progress until the individual is in good oral health because of the risk of high amounts of bacteria in their mouth that could potentially travel through their bloodstream during the procedure. And so oftentimes Medicare will pay for extractions or other dental care that will reduce the amount of bacteria that's in the mouth, but that's only a surface level. So they're not going to pay for crowns or bridges or anything like that. They're going to pay for the care that's required to immediately reduce the bacterial count in the mouth so that the follow-on medical procedure can continue.
So I know that, like, for our age, you can sign up for health insurance, but then you have the optional, dental and vision benefit. So is that the same, even as you get older, you still have to have some type of supplemental insurance? And if you're not working, so what are some of the options to even get, dental coverage?
So yes, just like working age adults, older adults who have Medicare, since it's not I guess a given benefit, what would normally happen is that seniors can pay for a supplemental benefit. But if they're not working, many are on limited incomes, they just don't have the financial resources to pay for supplemental dental care, because oftentimes out-of-pocket costs start at about $1,000. And that can be financially burdensome, leaving many to choose between housing or prescription and dental care. What is available, it's almost like a hodgepodge of resources. So older adults might be able to seek out community services, community clinics, or community care through local colleges that have dental clinics. Unfortunately, much of it is not organized in a manner that it's well known. And so these individuals are left to their own devices to try to figure out and navigate what is available in their community and what care they are and aren't eligible to receive.
I think that navigation part, I think, is hard for most people. So to me, that what comes to mind is maybe starting with, like, your area agency on aging, making contact with them to see what providers they could connect you with. And you also brought up the decision making that goes into this. So if you can't afford preventive care to get, like, your teeth cleaned every 6 months, or to deal with a cavity or a broken tooth early, sometimes I think they end up saying, well, it's just cheaper just to pull the tooth.
Right.
But if that's kind of because it is the least expensive thing to do, but talk a little bit about the consequences of having to make that decision. If you have to make it multiple times, what's going to happen?
Oh, yes, that is traumatic in most cases. So for older adults, they, of course, are going to have a higher risk of having broken teeth, cavities, and such. When they have the opportunity to access community dental care, as you mentioned, oftentimes they're doing what is most cost effective, and that would be extracting a tooth. However, because many older adults already have missing teeth, when you extract the teeth, you also have resultant bone loss. So for instance, the trees behind me, if trees were removed, the dirt that would hold the, the trees in place would essentially erode away. And that's essentially what happens to the mouth when teeth are taken out, the bone eventually erodes away. Having fewer teeth results in a significant alteration to how your teeth function in chewing and eating. And so that may alter the diet that an older adult is able to take in. So instead of having a nutritious diet that may consist of fruits and vegetables, they may have to rely on softer foods, which may have significant caloric intake. However, it might lack the nutritional requirements that they need.
Right. So that this is actually something that's impacted my grandmother. She's lived in rural North Carolina most of her life and doesn't have any teeth. But I will tell you something about Southerners. They can definitely still get a hold of a fried chicken and do just fine. So, but there are other implications of not having, teeth that I actually saw with her. Like she wouldn't want to go out to see people. So that results in social isolation, lack of kind of going out and engaging in life. So maybe talk a little bit about some of the other implications that happen with tooth loss or even having to make a decision to pull the tooth.
So other than health issues related to the mouth, nutritional wise, as you mentioned, this can lead to social isolation, embarrassment. Many people won't want to smile. They don't want to be in crowds. This could lead to depression and therefore increased isolation at a time when older adults, of course, need to socialize more. In having an impact mental wise, that could lead to a litany of other healthcare issues that an older adult is not able to even garner support for because they don't even want to interact with a provider to seek care for their teeth. They may see it as being something mundane. However, it has ripple effects on other aspects of their life.
True. I mean, because just not even getting out and going to be with friends or be social, then that also means you're not moving as much, which then increases your risk for fall. So it's kind of like, you don't really realize how important your teeth are, but they are actually quite important. And so one of the things that you mentioned was when you don't have teeth that you might have to adjust your diet and eat softer foods. So what are, like, if you already don't have teeth, do you have any suggestions for how to create a softer diet that's still nutritious for someone?
Certainly. So older adults are able to use canned foods. Those may be softer, or pureeing vegetables or fruits that might help. But oftentimes, there are some instances where states extend benefits for older adults into Medicaid. And so if they qualify, they may be able to get dentures, even though this may be limited. So it's important that older adults verify that this benefit is extended in their state, because Medicaid is a state benefit and states determine what benefits to allot to their population. Additionally, cutting foods in much smaller portions, taking a longer time to chew. If the teeth are only in the back, being careful to focus on drinking while eating. This may fill them up faster and they may not be able to get in as much. However, this would be better than sticking to a diet, say mostly mashed potatoes or some other soft food that might not be as nutritionally dense.
Yeah, so other things I can think of, even just putting, green beans are already soft, but you can put different foods into like your NutriBullet to blend those up. So you still have the flavor of the food, but you can make it softer.
So,
and then, smoothies, things like that. One thing I want you to tell, you had mentioned to me that you were at the beauty shop and there was an older person that you were talking to. Maybe set that up and tell that story.
oh, sure. So a few months ago, I was getting my hair done, And there was an older lady that was in a home. However, I had no idea who she was. The beautician later informed me that that was her mom, and they were preparing to go to a funeral. She was doing my hair, so she was probably going to miss the viewing. However, her mom was running about trying to get ready. And then she came in and she contemplated not going. And she expressed to her daughter that her mouth hurt and she didn't know if she really wanted to even bother, even though the person who passed was very significant to them. And her primary reason is not because I didn't have a ride or anything like that. It's centered solely on the fact that she received new dentures and it hurt. And so I asked her daughter if she wouldn't mind me sharing a couple tips because I'm a hygienist, and she said certainly we'd welcome it because she has not been wearing the dentures. So I took the opportunity to explain this is what happens to your mouth when your teeth are removed. And so because the bone is reforming, it's going to feel uncomfortable. And one thing that you need to do is make sure you go back to the dentist and get your dentures relined, because as your bone reforms, the dentures are going to need more support, and the bone being gone won't be sufficient, and that could cause pretty much pressure points. So think of if you had new shoes, you could get a blister. It would be essentially the same thing that a denture could do. I recommended that she also rinse with warm salt water and reach out to her local community dental clinic to see what services they could offer. These all seem like pretty simple, straightforward recommendations. However, she was unaware of them, and she was trying her best and she wanted to wear the dentures. However, the pain and discomfort as a result of having these dentures made her not want to wear it. And that would only result in further bone loss down the road.
So talk about that a little bit. Why does wearing your dentures prevent bone loss? Because I
So
mean, this has happened. I mean, this happened to my grandmother. She wouldn't wear her dentures either because it hurt her mouth, and so we need to let people know that that's not what you should do.
right, certainly. So when dentures are placed in, like I said earlier, think of a tree being ripped out of the dirt and the roots are now gone. The roots would anchor the dirt in place. If you were to place a protective barrier over it, say 2 cinder blocks, that would hold the remaining dirt in place. Some would be washed away. However, most of the dirt would remain in place. Well, it's the same thing for dentures. The dentures will help to keep the remaining bone in place. Now, the longer that one goes without wearing the dentures, the more the bone resorbs because there's nothing to essentially put some kind of friction against it. And so, in not having any resistance to help keep it in place, it just further resorbs and becomes smaller. And so, the denture constantly needs to be realigned.
So talk to me a little bit about why Medicare doesn't cover dental benefits and what the benefit would be if they did.
So, great question. When Medicare was originally passed, language was written into legislation, pretty much making an exception for covering dental care, except for medically necessary procedures. And that has stood since the inception of Medicare. Um,
60s.
since the 60s, yes. And so there have been a lot of efforts to change this. However, support has grown in the House, and we hope that it will progress into the Senate. Now, benefits of including a dental benefit in Medicare would be tremendous. Um, Older adults would be able to get dental checkups just like they get their medical checkups. They would be able to get annual cleanings, which reduces the significant bacterial load that contributes to everything from cavities to periodontal disease to gum infections. And so a dental benefit in Medicare would essentially supplement what older adults get for medical care, just like they're able to get their prescriptions, get their vaccinations and other benefits to keep them healthy physical wise. A dental benefit would keep them not only healthy oral wise, but it would also improve their overall general health.
Right. So, in thinking about how Medicare was set up, I mean, basically, Medicare Part A is your insurance, hospital insurance, and then Part B covers your health care. You get a welcome to Medicare visit, and then from there, I guess you get an annual exam if you don't have any illnesses.
Mhm.
So, those are preventive types of services. So, offering a dental preventive service actually just informs a person's overall health status. Are there any cost implications or kind of what would be the cost difference? Is there savings? Would it cost more money?
So, a number of states have tried to tackle this. Adding a dental benefit to Medicare would increase costs. However, costs would be offset by the number of health conditions that are precipitated by poor oral health. So, several states, Maryland most recently last year, launched a pilot program to extend oral health benefits to older adults and adults with disabilities to study what cost improvement would be realized from older adults not going to the emergency room for a broken tooth, or individuals not going to the emergency room to seek care for just tooth pain. Um, in the emergency room, they can't do any care, what we would consider definitive care. So definitive care would be a fill-in, an extraction, or even a cleaning. What essentially would be provided in an ER is antibiotics for the bacteria or some kind of pain medication to help dull the pain. But that's not actually treating what's causing the pain. So every time someone goes to the ER, we know that the cost is significantly higher. Um, in going to the ER just to get antibiotics or pain medication, that cost would be 2 to 3 times what a cleaning would be just for that medication. So adding a dental benefit to Medicare would essentially reduce that cost that the government would be absorbing for the older adult accessing the ER for dental care that is not actually dental treatment.
True. And if you had a dental benefit, when you began to have an issue with your teeth, you would know that you could go see somebody about it and actually have it kind of nipped in the bud and fixed before it got to the point that you had a massive infection. Your teeth are on the same plane as your heart. And so you
Right.
had mentioned, like, if you have issues with your teeth, it can result in chronic conditions. So talk to me a little bit about, because of, you know, how we're wired up, if you have issues with your teeth, what are some things that you're setting yourself up for?
So if you have problems with your teeth, you're setting yourself up for a host of internal issues. Um, Anytime there is an issue in the mouth, it can impact everything from heart disease to diabetes. Um, High bacterial load in the mouth seeps into the bloodstream, and that could cause what's called bacterial endocarditis. So it eats away at the valves. Um, there have been cases where the bacteria have leached into the system and caused a brain infection. People have died as a result of those brain infections. Yes.
So now let's talk a little bit about what people can do. So if you're interested in, learning more about what Medicare can do related to dental benefits, what are some, like, a call to action that people could do?
For a call to action, I would always recommend that individuals, old and young, seek out their representative, state representative, as well as their senators and congressmen or women who are on the Hill, encouraging them to add a dental benefit to Medicare is essential, because even if they're young, that's a benefit that they will possibly access later in life. Senators are aware that this is an ongoing issue and we've gained traction over time. But as with all legislation, the more people who are motivated to engage and say, hey, this is something that's a concern of mine. Here are the implications that I've suffered as a result of your lack of support. And these are the constituents in your areas who are suffering because of this lack of benefit. That will hopefully help, help to catalyze some kind of change in future legislation that is introduced. Additionally, we want to ensure that individuals and communities are accessing the benefits that are available. Oftentimes, states may have pilot programs or extend benefits through Medicaid or a supplemental clinic. If these benefits aren't used, then oftentimes they shut down. However, most times they're not just used, they are used to the extreme, to the point that the individuals who are paid to be there are so extended that they don't even have a break in the time to do additional care for the people who they're serving. They are stacked because there is such a need for dental care. Finally, want to ensure that individuals are aware of the importance of dental care. Being able to pass on education is significant. My grandmother has no teeth, and so growing up, I thought it was normal for an older person not to have teeth. And my grandmother said, my mother didn't have teeth. And so for her, it was normalized to not having teeth. And so the call for action, I think, starts in our own individual homes to say, you should have your teeth. Your teeth are meant to last your lifetime, and not normalizing loss of teeth is important because as you get older, things will change. However, I think back to a Sonicare commercial, and there was an old lady, and it was almost, I think they had her use her teeth to pull something heavy to show how strong her teeth were. And that's to show, yes, you can have your teeth when you're old. And no, you don't need to have Polident or use Polygrip or whatever else, to keep it in if you have dentures. So definitely normalizing having teeth when you're older from someone as a child is really important to ensuring that they are aware that they should keep their teeth when they're older.
True. I think there's a lot of things that people don't understand about the normal aging. You should have your teeth. But
Mm-hmm.
what we commonly see is that older adults don't have teeth, but that is not a normal part of aging. So I totally agree with that. So it sounds like we have I know that there's one bill called Seniors Have Eyes, Ears, and Teeth.
Mm-hmm.
So that's one thing to watch. And then you mentioned another one.
Yeah.
Um,
Medicare and Medicaid dental vision benefit. That was a 2019 act, and also HR 3. Both of those are trying to put together the benefits that seniors are most impacted by. Hearing aids, that's not a covered benefit, but many older adults have loss of hearing. A lot of seniors also have loss of vision, and that's not always covered. And they also have loss of teeth, and that's not covered. So these benefits these bills are aiming to address the deficiency in our current benefit stream for the most vulnerable population.
True. And your eyes and your ears and your teeth are all connected to brain health. And so, thinking about people ending up with memory issues, also depression, social isolation. So all three of these things are important, which I think is why they've bundled them. And so I want to thank you for being with me today. And we'll let people get in touch with their legislators. And I think that they've learned some things about how to take care of their teeth. And I appreciate you being with me today.
Thank you, Melissa. Thank you for having me today.
So I'd like to thank Taneika for being with us today and sharing why it's so important to take care of our teeth as we age. And we've talked a little bit about some of the legislative opportunities that we have to change kind of the insurance structure here in the US, but also wanted you to be aware of a couple of other resources that are available. So the Health Resources and Services Administration released a report for how to integrate oral health into primary care. And also wanted to let you know that the New York University Rory Myers College of Nursing, along with the NYU School of Dentistry, they have actually developed some interprofessional competencies that you can access. So together with the advancements in curriculum, training opportunities, and development of clinical practice guidelines, all of these things are important to create age-friendly, evidence-based care to improve health outcomes for older adults. Hopefully the policy change will follow. So if you are an older adult or a caregiver, when you go to see your primary care provider, please also ask them to look at your mouth because it just might save your life. So thank you for being with me today, and we'll look forward to seeing you next time. Thank you for joining me today for This is Getting Old. If you'd like to know more, you can subscribe to my YouTube channel. And if you have any questions or a related topic you'd like to hear from me about, just let me know.